our community director from ECHAlliance. We have also the pleasure to have with us one of the most important ecosystem that will share with us its experience. We have Regina Rosta-Pethő, I don't know if I pronounce it correctly, from Pannon Business Network Association from Hungary. And we have also Bernadett S from the Ministry of Public Administration and Regional Development in Hungary. So,
hi, everyone.
Hi, good afternoon. Thank you for joining us and for bringing your experience here with us and sharing with us. So I give the floor to Andy.
Well, good afternoon. And this is a nice experience because what we're going to do today as part of this webinar is something a little bit different. Okay, rather than just give a talk about what we do within the ECHAlliance and our ecosystem concept and our network, we wanted to bring in some of our partners from another project that we're working on called Project Notre. And they'll talk about some of the experiences they've got of actually building an ecosystem. Okay. From a Hungarian point of view. So we've got Regina and Bernadett also to talk later on about how they do it and some of the issues they found along with colleagues there, but also some of the learnings as well. Because that's the concept for today. It's the idea of learning from the best. I've got some slides and I'll go through those in a moment. But I thought it's poignant and important to understand the following. Last week, I went along to the ecosystem in Greater Manchester in the UK. Why is that important, you say? Well, because that's the first ecosystem that I ever went to many, many, many years ago. In fact, indeed, it was the first ever ecosystem that we developed for ECHAlliance, and I've been going ever since. So that's an example of what we talk about when we talk about sustainable ecosystems, because that ecosystem has been running for the best part of 12, 13 years. And I went along and joined it as a member many, many, many years ago, when there was probably a little bit more hair on the top of my head. But I joined it for a reason, and you'll understand the reason when I come to discussing a little bit about our ecosystem network. Let me just share some slides with you though, because this may help for you to then get an understanding of what I think is quite a basic concept about ecosystems, okay? But also how that translates into practice. So just a bit of background for you. My background in health and social care go back over 30 plus years. It used to be 20 plus years, but that was about 10 years ago. So I have to update the stats every now and again. That experience has led me to work in various different systems across the UK and across Europe in health and social care. I work for an organisation called the ECHAlliance. We're the Global Health Connector. For those people who don't know who we are, very, very quickly, let me just explain to you. We're a member organisation. Okay, we have about 1,100 members, many of whom are on the call today. There are about 1,100 of those member organisations within the ECHAlliance, and they're from all sorts of different sectors: universities, research organisations, care providers, industry specialists, hospitals, patient groups, carer groups, etc. All different. And we bring them together in a network of ecosystems all over the globe. Over 80 different ecosystems. They're all different, and long may they be so as well, because that reflects the difference in terms of local understandings and local needs. We've also developed a network of what we call thematic ecosystems. We'll talk to you about those perhaps later. When I talk about ecosystems, I'll tell you a bit more about that concept in a minute, but the idea of those ecosystems, that's where we do these four things in front of you. We either connect people together, we convene them together in ecosystems, we amplify what our members do, and we accelerate that innovation and that piece of work that they do across the globe. That's a little bit about us. But the ecosystem concept is quite basic. And those were on the previous webinar will have heard me talking about this idea of building a permanent multi-stakeholder gathering of all the stakeholders of health and social care to come together to match need and solution Now, many of you will have seen talks and slideshows about ecosystems all over the web, especially on LinkedIn. Very complex, very detailed, very focused. Ours isn't that. Ours is very, very light in terms of detail because our concept's built around this idea of matching need and solution. So it's not industry-based, it's not wholly focused on the development of electronic goods, etc. Understanding that enables, I think, a better understanding of how our ecosystems work. And they work to do one of three things. One is to break down silos in care, of which are as many now as when I first started, if not more, in health and social care, largely because of the development of mobile phones, not because of them. Also, they're there to transform healthcare delivery. So they're actually there to do something. So last week in Manchester, that session was around the use of extended reality in mental health provision. How could that actually impact and change mental health provision? Now, that for me was fascinating because my background started off in working in mental health, and the idea of using digital health tools or emojis or VR and XR was completely alien in those days. So they're there to do something. And then lastly, they're there to create economic growth, because if you spend that much money on one area in a country's budget, why wouldn't you see that as an economic opportunity? So again, permanent multi-stakeholder gatherings, bringing together all of the stakeholders you can see in front of you in that diagram, deliberately kept simple. And they're there to match need and solution. Now, we've brought together now a network and grown a network of ecosystems, some of which you're going to hear from today from Hungary, but also with Italy, and we've got colleagues from ISRA there who lead our Italian ecosystem. But as countries as diverse as Argentina, to Zimbabwe, also in Australia as well. And that network of ecosystems is there to help accelerate that innovation and to bring best practice from one area to another. The way in which we've done that most recently is to build brand new ecosystems in the US, which we're looking to open up more this year across Chicago, Nashville, and we're just about to launch our latest in Los Angeles. But also in Africa, where we're starting to build ecosystems in Uganda and in Senegal and Tanzania, as well as countries like Zimbabwe. This creates that global network where we can facilitate connections and help extend and increase the level of acceleration. What that also does is gives us an opportunity to bring people together in what we call thematic ecosystems, which are global in content. They might be on areas such as mental health or healthy aging or women's health. These are opportunities to showcase our members, but also the members of our ecosystems, whether it's from Sweden or indeed from colleagues from within Western Hungary as well. To showcase the best in show, to stop people doing what we've got a particular problem with in health, which is reinventing the wheel. So let's just get into some facts around ecosystems, because much of this information is public and well developed by us. But I want to talk to you about what ecosystems are not, okay? Because very often if you Google ecosystems or start searching on some of the sort of social media sites, you start seeing these fantastically complex diagrams with hundreds of images and like logos and icons, none of which are relevant. None of them. Ecosystems are not complex, okay? They're not in need of consistent review and academic repurposing. They're very simple. They should be around matching need and solution. That's the same in the health industry as it is in the aerospace industry, as it is in farming, okay? The same concept can apply. They're also not industry focused. So some of the industry focused ecosystems you've seen that have been developed and talked about, they're not ecosystems because they don't contain and include the rest of that network, that patient end user at the beginning involvement. So we see them as being leading with a need as opposed to leading with a solution. So they're also not solution focused. So none of those ecosystems that we look to bring together are there just showing off, shiny white goods or new solutions, just new services. So if we're going to look at an ecosystem, and I'll just pick a random area, such as one on diabetes, We wouldn't start off with a solution for people to help them manage their diabetes. More important, we start off with what it's like to have that diagnosis. What do you need in terms of education and research? What do you need in terms of services and solutions? The other thing is about ecosystems, they're not also just purely academic focused, because the danger is there. It's great for sharing of papers and very long-winded reports, but there's no action. So as I said, there should be places where things happen and get transformed, as opposed to just a talking shop. Academics are welcome, as our industry, but that need is there to bring in all those key components of that circle that you can see in front of you, leading with a need, and then bringing in the other players. So for instance, on the diabetes example, I would look to bring in patients, carers, healthcare professionals, also policy people from government bodies, such as you're going to hear from later on, to talk about what they need to understand in terms of trends or patterns in terms of disease prevalence, etc. But also research organizations to say, well, this is the type of data we need. They're also not static. So the idea that we focus on diabetes this quarter, with next quarter might focus on cancer or mental health, or move on and look at different areas of digital health. So this idea that there's a consistency that builds in a level of permanence for those people who want to take part. So that's what an ecosystem isn't. If you want to go to organizations and ecosystems that are complex, industry focused, and are static, you're going to be probably a little bit bored and probably not very, very engaged. So how do we go about setting up that ecosystem? We have an approach with my colleague Adriana here, which is quite small but ambitious, which is to try and understand within your local ecosystem, your local network, who are your leads? Who are those key stakeholders that you need to bring in? Are they networks that already exist? Are they coming from perhaps regional or national government bodies? Have you got people there who've got an interest in economic development? You also need to understand some of the resources that you need, because someone's going to need to organise this, host them, etc., put on a venue, maybe even stick up some coffees, etc. But the other thing you're going to have to do as an ecosystem is understand who your stakeholders are. Who are those important patient groups that you need to speak to? Who are the networks we need to include? But also, quite importantly, who do we need to be aware of that might want to take this over and hijack this? Because these are people you want to avoid, because they're not very inclusive. You want to make sure you've got organizations that are in that ecosystem that are inclusive in their way they work with people, as opposed to those that seek to preclude and drive the debate. We can then help you identify who's missing from those stakeholders, because obviously we're a member organization. We've got lots of members that maybe have connections in your area. So obviously, you know, the local lead in West Hungary with Pannon Business Network should know most of those local stakeholders, but there might be a few patient organizations that are members of us we can make some connections with, and that's useful. So that use of a network of members that already exist becomes ever more crucial. So we all say to people, join us as a member, we'll be better able to connect you. But then lastly, and this is where we build in something different, what the ECHAlliance have got is that global network, that implementation network of ecosystems that are doing this already. So it's best then to learn from what they're doing up in Treviso with Nicola from ISRA around dementia than just try and invent it yourself. Or best bringing best practice from engaging in with SMEs, as happens in West Hungary. Because that network's there already, and best for us to connect with. So we already, with Adriana, my colleague here, bring our ecosystems together every 6 weeks as part of our coordinators group to better connect them. And that's been ongoing for some time now. So it helps to bring in that input from other networks. And then lastly, this. What you need to think about then is as a group of stakeholders, no matter what area you're focused on or what geographic area, is you need to set about with those stakeholders to define what are the issues there in that region that are most important. Not all of them. What are the most important ones? The ones that we can hit first. Because there's one thing worse than making an ecosystem complex, it's delaying it. The longer you delay, the more naval contemplations we sort of talked about in the UK, the more talking that happens, the less action. And some of the ecosystems I've worked with over the years have taken far too long to set up because they're trying to get that first issue right, as opposed to 80% better is better than nothing. So we always say to people, go with that thing that you think is the most important priority, which you want to target first. And also try and decide, who's going to decide that level of prioritization? Is this something you want to do very democratically? Do you want to engage all the stakeholders and get them to do it, perhaps via a video consultation or a poll or a survey? But also it's quite important is you need to understand who doesn't make the decision. So it might not be something you just leave perhaps for a political choice, because that's then going to be biased towards one party or another, depending on your political outlook locally, and that will change. So make sure you've got involvement from all those stakeholders in deciding some of those priorities, but also don't let one organization lead that or drive it only. And then these last two topics. So we always say with our ecosystem network, build it first and people will come. It's not going to be perfect. Perfect is the enemy of the good, I always say, because if you're waiting for something to be perfect, you'll be waiting a long time. So when you decided what your priority area might be, or your priority 3 areas might be, pick the first one. Pick a topic, pick a date, get a venue, and get it announced. The sooner you do that, the sooner that ecosystem can start. The longer you wait, the more people will think, no, this isn't going to happen. So we always have this very, very basic concept. Pick a topic, pick a date, pick a venue, and people will come. Now, I'm going to hand over now because I want to give you a chance to listen to what I think are two really different examples of the experiences of building an ecosystem, but not from my point of view, because I'm biased. I've seen different ones from all over the globe, but a specific point of view from colleagues from Hungary, from Pannon Business Networks, but also from the government administration department as well. You can see here there's a couple of QR codes to either subscribe to our newsletter or indeed to become a ECHAlliance member. We've got QR code up, hoping that all of you are now busily pointing your phones at the screen. Unfortunately, I'm going to stop sharing my screen now and hand you back. I think, Dim, if I come back to you, or Fede, and you introduce our next speaker, please. If there's any questions as well.
I don't know if someone has already some question, or better wait the 10 minutes before the end. I will give the floor to Regina from Pannon Business Network Association from Hungary, our ecosystem in Hungary. I don't know, Regina, do you need to share your screen or?
I did it. Yes. Do you see it? Okay,
yes,
perfect.
Not in the full screen.
Yeah, I tried to zoom it. Okay. So, thank you, Andy, to introduce the.
It's not full the screen yet.
No?
No,
for me, it's
not for me.
Oh, sorry. Then I try to find another way.
It might be you have two screens, Regina, and you might just drag the picture from one to the other.
And now? Do you see that?
Now it's still on.
Nope.
Okay, so that. Oh. It is the same now, but you cannot see it in the full screen mode.
Let's see. No, but I mean, it's not Huge problem.
Okay,
Don't
so
worry about
sorry, I don't know what's the technical problem at my desktop, but I hopefully you can enjoy and understand what I would like to introduce you. So firstly, I would like to thank you, Andy, for the general introduction about the ecosystems, how to build an ecosystem. And within my presentation, I would like to introduce you how we build an ecosystem from a one organization point of view. So this organization, what I mean is the At Home, which is the digitalization in senior care. So firstly, I would like to highlight who we are and what we are doing, and how we can taking part and what kind of results do we have in the ecosystem activities. So Pannon Business Network, PBN, is our main organization, which is a knowledge transfer center in the West Transdanubian region in Hungary. Today you will listen another point of view, other ecosystem in Hungary at national level, but what we are focused on, it's rather a regional and the local aspects. So PBN, it's basically business support organization dealing with more than 100 SMEs, and we are working together in different kind of international projects with more than 400 international partners across Europe. PBN has two main focuses. The first is supporting companies in digital transformation processes through offering them Industry 4.0 solutions in the frame of Digital Innovation Hub. It is called AM Lab. And the other focus is the digitalization in senior care. This division is called At Home. So At Home has a demonstration room here in Szombathely in our city, which can offer for the target groups, which are mainly seniors and of course companies as well. And this room is equipped with more than 50 smart devices, and this assistive technologies reflected to the main crucial problems of the elderly, which are the health monitoring and safety solutions and well-being solutions, which contains entertainment and physical conditions support in the form of different devices. So besides this awareness raising activity, we have a bigger focus on R&D services and test infrastructure. So R&D services means that we are able to support and guide developments from ID phase to prototyping phase, especially in the field of senior care. And for those products which are developed in these circumstances, we can give a test environment where these products could be tested. And this test environment means a validation process of finished or semi-finished products, and these products could be tested in a real and a simulated environment with the involvement of the end users, which are in our case seniors. And it means that the the users, the testers can test their products in their own home, so at home. And on the other hand, Smart Senior Room, this demonstration room, are also serves as a simulated environment to test the product. So based on the user feedbacks, we can support companies with advices how they further develop their products in order to fit with the market needs as much as possible. And it means that the end users and this testing services, test service means that the end users are also channeled into the innovation processes, and it's organized in a formal way. We have a community which contains very open-minded elderlies, and it's called Silver Club. And these elderlies are very engaged to taking part in the innovation processes and give feedback on the products what they tested. And on this way, it has a social mission, or activities has also a social mission, because the Silver Club could offer for the elderlies also a community where they can belong to, and it's important for them, and they are very happy and satisfied with this membership. They really want to use that their opinion can count, and it could be useful for further developments and in the economic environment as well. So at home, it's just one member of our local health ecosystem. But as you can see here, we are working together with different type of organizations. So mainly it's generated from bottom-up systems. So we have direct contact with these organizations. From government level, we work together with the municipality of Szombathely and its institutions.
Excuse me, Regina.
Yep.
You don't, I think you don't. Your slides do not move, so we see the first slide still.
Oh no, really? So
Yeah. Now it's okay.
I try to share again. And now?
Yeah.
Is it the full screen mode?
No, but we can see the slide.
Oh, but it's the slides are animated, so I'm sure that you cannot really enjoy it in this form. I don't know how does it.
Maybe if you check at the right down corner of your window.
Yes.
There is an option there to share the whole window. Maybe this works.
Oh, so that's.
Maybe I can help. If I put a message here, I can maybe take over the screen.
Okay. Yes, I approved it.
Let me see if I can do this. I think what the trouble is have you got two screens in front of you?
No. It's just one screen.
So if I can press here, but unfortunately, do you have on a keyboard? Do you have the function buttons at the top from 1 to 12? F1,
Yeah.
F2. Yeah.
Yeah.
You press F5. See what happens then. Maybe nothing.
Just nothing. Nothing happened.
Okay. I think we just stick with this. Just be aware you'll need to move down and literally every time you want to change a slide from number 12 to number 13, you just click on the next slide if you can, because otherwise we're not seeing your slides. Because we're 12, I think now, is it number? Yeah,
Oops, sorry for this technical.
That's okay.
Okay, you can click on this. It's this slide is fully animated, so that
it won't let me move. It won't let me move. Sorry.
You can move.
No, I can't for some reason.
You cannot. So that
no.
And now
I'll give it back to you, and then you should be able to move it to the next slide.
Okay.
Sorry.
Sorry for this. The biggest problem that I cannot see that what you see, so that because for me it's totally in a fine mode. Just a moment.
Okay.
Optimism. And now it's the same for you.
Hang on.
It's moving. It's moving. It's doing
Something's
something. Something's happening. Yeah.
Yeah. Okay. So
Blank.
then
We've got a blank
Now
screen.
it's black.
But
Black
it's full,
screen.
so we've got a full screen at least, but not the slides.
okay.
Let's try again.
I cannot. Okay, then I try to explain you what you should see, so that we together with the government. So do you see the circles with different marked with different colors on the screen?
No,
No, because that's the previous slide or the next one.
So
yeah. Now we see.
so this the overcrowded slide.
yes.
So okay, and try to show you what we are doing. So these dots represent those partners, the top of partners who we work together. So on governmental level, we work together with municipality of Szombathely and different kind of social care centers, and we organize together conferences, events, and awareness raising activities for the wider audience and the citizens, of course. And on this and at the academy level, we are in contact with different higher educational institutions and vocational training centers, and what we are doing together is to elaborate training programs for professionals, healthcare professionals, and for social care, formal and informal caregivers as well. And on the other hand, we work together to initiate ID competition where students with different backgrounds work together for product developments which are targeted elderly people, and these ideas could be further developed in the direction to startup activities. And of course, besides these activities, we offer for these companies, for this educational organizations for practical training place where the students come to us and visit our demonstration room. So when we are talking about civil society, our partners are fully engaged to supporting us in awareness raising activity to reach the elderly and spread our knowledge and experiences for them. And of course, on the other hand, they are supporting us in the recruiting seniors for tests. As the industry partners, we have different, basically two type of cooperation type. The first is to work together and develop some products, and on the other hand, we work together with companies who has a product or a service which could be tested by the elderly, by the seniors. So private nursery homes and sports companies could be also a partner. Maybe I would like to highlight one company, which is a Dimetzer. It's the winner of the first startup competition of the city, and we work with these companies 2 years since 2 years ago to develop their ID and the product, which is a smart medical dispenser. It's in a prototyping phase now, and 2 weeks ago they was guided by our colleagues on a MedTech fair in France, in Grenoble. Okay. So our activity, it's so this was our activity from our point of view, from At Home's point of view, but it is part of a bigger ecosystem with a bigger cooperation, which is called Szombathely 2030. It's the long-term development, economic development program of the municipality of Szombathely, and this program is aiming to build a resilient ecosystem, focusing on education and R&D, and it's targeted to implement a successful industrial restructuring, and they are defining a new industry, which is the healthcare industry, which could be a breakout point for the local economy. It's within the healthcare industry, we are focusing on complex rehabilitation. This was based on the endogenous resources and the local traditions. What's the unique aspects of this of this program? That it was jointly developed by the local stakeholders. It means that the main employers, the government, those type of organization, what was mentioned in the previous slides, that the academia level, industry actors, civil society, and the governmental actors also sit to one table and start to discuss about the situation. What's the problem? What will be the problem? How we can find a new solution together, which everybody knows their vision in this cooperation. And this program was jointly developed with each partners, and it was formally accepted 2 years ago, but it's not just at local level was accepted, but also at national level, and it was integrated into the spatial planning procedures at national level. So the program contains and defines different flagship projects, and at home can taking part in this project in the test before investment direction. So with the intelligent, with a smart senior room and testing environment can join 2D and complete this ecosystem. So as you can see that at home is not just a dot in this context. We are fully integrated into the local ecosystem, and besides this, it's very important that not just regionally existing and see your cooperation on the map, but also at European level. So therefore, it's very important to strengthen the connection with the European organization and networks as well, like ECHAlliance. And of course, beyond the European borders, we have initiative to work together with our main focus areas. So if I have time, just shortly mention 2 examples where international partners work together for developing and improve the ecosystem, local and health ecosystems. The one is the NOTRE project, and where partners try to find good practices, how they can improve policies in order to support on a more effective way the companies, especially senior care related companies and the healthcare meta companies. And other project is the Connecting Health project, which is about to connecting the dots within the digital health ecosystem. And it is this project is led by ECHAlliance. And in this project, we are on the phase to involve all expert and listen the opinion and integrate these opinions into the policy recommendation. So I would like to invite you to join us for the focus group meetings and share your thoughts, which can be an added value into this activity in this process. So basically, that's all what I would like to introduce today. Maybe after Bernadette's presentation, we can highlighting how we can connect with the national level as well. So thank you, and sorry for this technical.
Thank you, Regina. I'm sorry for the technical problems for the audience too, but maybe if you can share with us the slides later, you can send it to me or Adriana. Maybe I can share the presentation with the participants today. And if necessary, they can follow up also with you with other questions. So I give the floor, because we are running late, to Bernadett from the Ministry of Public Administration and Regional Development from Hungary. Bernadett, the floor is yours.
Can you see my screen?
Yes.
Just a second. Okay, so I'm here on behalf of the Ministry of, sorry, I don't know what's going on, but Now I think it's okay. So I'm here on behalf of the Ministry of Regional Development and Public Administration. And this is a new ministry, but we are operating under the ministry as a managing authority for economic development and innovation and operational program, which is a national level program, development program, and it has 5 support areas: SME development, research development, and innovation, higher education, vocational training, sustainable labor market, and financial instruments. And within the managing authority, we as an international and cluster units are trying to be part of international projects, most of Interreg Europe, Interreg Central Europe, and Danube region projects. And we are also dealing with the tasks of cooperation with clusters and being in cooperation with them. And also we are responsible for the cluster strategy. And first, I think first we met with Andy within the Notre project that Regina also mentioned. We are part in that project as project partner, and we would like to develop our development program as a policy instrument based on the results achieved within the project. And within the project, and the ECHAlliance is helping us to build a successful and sustainable ecosystem and also maintaining the commitment. So we are learning very useful skills from the training. And I would like to give you a short background of the cluster ecosystem, because we as a ministry, for us as a ministry and as a managing authority, it's the easiest way for us to keep in contact with the SMEs, with the companies, through clusters. They are as a bridge for us, and nowadays we have a very good cooperation with them. A second, because I don't know what's going on with my screen. Just a minute. So yes, in the past 20 years, we had numerous of clusters that they are started operating. For example, in 2013, we had around 200 clusters, but only 34 accredited. And in the latest years, because the past 15 years, we have no domestic initiatives, we had no results with them. And within the latest years, it was for us a period of consolidation and purity, as the clusters that did not actively participate in the activities and cooperation, and they decided to only be there for gaining some supports and money, dropped out or changed their way of thinking and turned to an active member. But in 2022, we had around 40 clusters, from which 26 accredited, and it was a successful result from our point of view. And we have organized so-called roadshow to meet all of them, to understand the challenges that they face, to understand the help they need, to learn the success stories, and to use the provided information as a source of change, and to be able to create this solid ecosystem. And within the programming period 2014 and 2020, we provided them support for professional cluster organizations, and within the current programming period, we launched the cluster strategy. The aim of the strategy is to achieve at least one cooperation with outstanding innovation capacity and international visibility in Hungary's main key sectors by bringing together the key players within the industry, and to ensure that 10% of the total gross value added is generated by economic players operating in this cooperation. And to the certification process that we are now making within the government, we would like to support the development and the quality clusters through 3 stages, and the renewal of the accreditation system, we would like to help them, and there will be 3 stages, 3 types of clusters: registered clusters, professional clusters, and innovation clusters. And they will benefit from different kind of supports. We have 6 billion forints, around 15 million euro for cluster manager operational support, and we have around 5 million euro indirect support for training, consultation, general support of management, and also research and development for cluster members. And now we are in the process of setting up a cluster academy in cooperation with the Hungarian Economic Development Research and Innovation Agency for SMEs. And within the process, we are involving the cluster managers and members of the clusters, because we would like to create a toolkit and the training that really addresses the weaknesses. So we would like to assess the requirements with them to provide them help, not for the actual clusters, but the future clusters and future cluster managers as well. And clusters for us are really important because, for example, within now you can see the details just in short. Sorry. Yes, I just thought about that we have how many accredited and not accredited clusters we have. We have around 1,000 members, and the total revenue of the member companies are 3 billion forints, and major cluster industries are ICT, food industry, packaging, healthcare industry, machine industry, and focusing on environmental and energy industry. And why it is important to us, for example, I think 2 weeks ago we had a cluster info day where we presented all the opportunities regarding the international projects, and we presented the accreditation system of the cluster strategy. But we had a separate meeting with the MediCluster, and together with also with Regina the coordinator of At Home, and it was a very successful discussion, and it started out from the event that we joined, and later on we had a discussion with the MediCluster, as I told you, and we try to identify the common fields, the opportunities, the cooperation that we can build, and they find the PBN's solution very, very useful, and the at-home test environment very useful for them, and they find the Not Report project as well very useful, and they gave us other contacts. We contacted, for example, the National Center of Hospital Services, that they are in contact with them. We contacted some very small enterprises that they are developing, for example, gaming solutions that help prevention dementia, for example, and these were us very good results, and we since then we had another meeting with them, and we are trying to maintain this cooperation, and they gave us very good feedbacks as well. So for us, clusters are a very useful connection, and we try to be very helpful for them as well. And mainly the cooperation between us starts by joining an event organized by them, or they are joining events organized by us. And for example, we had Cluster Managers Club. We have annual opening events attended, organized by them. We have the Cluster Info Day, stakeholder meeting for the clusters relevant and in line with the topic of the project. But we also we are planning to organize in each year international cluster conference, because they are focusing mostly on the international market, and they are exporting their products, and I think so we think that this ecosystem, it's very useful for everybody. And thank you so much.
Thank you very much both for sharing your experience. Now it's time for the Q&A. I don't know if there are any questions from the audience, or anyone that wants to mention or comment something. Andy has raised his hand.
Yes, just a quick question. Bernadett, I think what was interesting for us was that there's other health clusters, and I think it'd be useful to think about how we can bring them into that network of ecosystems that we got. Obviously, we have other clusters, but the singular thing that links them together is their focus on health. So it'd be useful to have a conversation perhaps with you.
Yes, now we are planning actually to bring them to the next partner meeting in San Sebastian.
Good, excellent. Sounds like a plan.
Yeah, and I think the most important things to start to work with Meta cluster is that we try to find a common interest, how we can work together, and but it means that we have to sit to a table and to discuss what you need, what we can offer to you, and it was just So any concrete things was happened at the end, but we just get to know each other and start to thinking on how we can work together. Where's those points we can contact and start to join joint initiative. So
I think it'd be useful as well to get you along, Regina, to one of our coordinator calls that Adriana organizes for our ecosystems. So we'll give you some details about that too, because it'd be good to get you to talk a bit more about that ecosystem there.
yeah. Okay, thanks.
Thank you, Antti. For me, one question, like for both of you, since you are very well experienced and working years in with clusters and networks. What are can you like pinpoint some key characteristics of successful clusters or successful ecosystems so that we can have a summary from this session?
Bernie, or
maybe you can start, Regina.
okay, then me. So I think the key success factor was that to what Andy also mentioned, that to organize something, take the lead to organize an event, and the other hand, it should be a regular event. So it's not just one occasion that, okay, just sit together and this talking about what we have. Yeah, you have the same problem. Oh, it's terrible. So we're not just crying and focusing, not just crying around the table, but to really find this cooperation points. Yeah, but I don't know how does it work in other countries, but in Hungary it's general that we are sitting together and try to just cry. How awful our situation. But if you have so from point of view, we are always organizing event and we highlighting that we know that it's not an easy situation, but we have to do something and try to focusing on the good direction, not to the back. So forward, not backwards, so that it's very important.
Thank
I
you,
think
Regina.
so. Regular meetings, it's very useful.
I totally understood. Agree with Regina. From our point of view and experiences, I think it's to understand them and to being contacted them as organizing their events, but giving them a call. How are you? What they are doing, and being as a friend for them. For example, for the cluster managers, it's a good point to know what's going on in each part, and attending the events whenever in Hungary, and to be there for them. And when they feel this support, then they are more open.
Do you want me to ask there's a question here from Risky, a chap from Indonesia. Thanks for your question on sugar companies. I appreciate you're very much focused on sugar companies, but we don't necessarily have the answers in terms of how artificial sweeteners can be used, but certainly the partnerships across Europe and beyond around partnering with other sugar companies is one which is interesting in the world of diabetes, but that's probably a discussion for another day. We can pick up on LinkedIn. But the other question was about the date for the meeting in San Sebastian. We have a date. The best person to tell you that date is, in fact,
I can say, I think if I'm not mistaken, it's 23rd, 24th of April in San Sebastian. And that's for the people involved in the NOTRE project and the corresponding stakeholders from each of the partners involved.
There you go.
Yes, we can confirm the date. It's the same,
Yes.
24th and 25th.
So,
And the last
Adam,
from is avoid, if you think you're going to turn up for the meeting and everyone's going to be there crying, find another meeting to go to, because they're usually worth avoiding. It's a good understanding. I think very often when you're only focused on the negativity within the system and how bad your system is and how long the waiting lists are and how many, you'll never get anywhere. So it needs to be, pushing towards how can we actually transform things.
So thank you all for your participation. Our next session will be on networking and how we can learn the basics for enlarging ecosystems. And you are all invited there. It will be during the second week of March. Please follow us on social media and stay tuned for the exact date and the details to join us. Thank you very much, Regina and Bernadett. Thank you all.
Thank you for the
Have a nice-
invitation.
Thank you.
Thank you. Have a nice
Thank you,
evening.
Regina, Bernadett. Thank you so much. And thank you, Andy, and all the participants.